Hello friends, welcome to Creative Medicine. In this lecture, we will learn about smallest muscle in the body is one of the muscle in the ear, which is stapedius is the smallest muscle in the jaw in the body. So stapedius is the smallest skeletal muscle in the body is stapedius, and the smallest muscle in the body is erectile pylorium. Smallest skeletal muscle is stapedius and smallest muscle in the body is erectile pylorium, which is a smooth muscle which is required for erection of hair. Composite muscles include all of the following except the adductor magnus is a composite muscle, and biceps femoris and pectineus are composite muscle. Rectus femoris is not a composite muscle. Composite muscles are those which are supplied by two different nerve supply, whereas rectus femoris is only supplied by one nerve, which is femoral nerve. All of the following are composite muscles except composite muscles given here are pectineus, flexor digitorum profundus and biceps femoris are composite muscle, whereas flexor carpi ulnaris is supplied only by ulnar nerve, whereas pectineus is supplied by femoral nerve, whereas anterior fibers are by femoral nerve, whereas posterior fibers are by obturator nerve. Whereas in the long head of femoris, biceps femoris, it has two heads. One, it has long head. Long head is supplied by the tibial part of sciatic nerve. It is supplied by tibial part of sciatic nerve. And then we have short head, which is supplied by the common peroneal nerve. Short head is supplied by common peroneal nerve. Then flexor digitorum profundus. In this, the radial half is supplied by the median nerve, whereas ulnar part is supplied by the ulnar nerve. So these are the different nerves and their innervations. Okay, next. Muscles having dual nerve supply is, in this the digastric has dual nerve supply. Digastric muscle, trapezius muscle and adductor magnus has dual nerve supply. Digastric, it has two roots of digastric are present, two bellies. So anterior belly and posterior belly. Anterior belly is supplied by the trigeminal nerve, whereas posterior belly is supplied by the facial nerve. Whereas trapezius, it is supplied by number 1 spinal accessory nerve, and it is also supplied by the ventral rami of C3 and C4 for proprioception. Whereas adductor magnus, if you see the ischial part is supplied by the tibial part of sciatic nerve, whereas adductor part of adductor magnus is supplied by the obturator nerve. So these are the different nerves and their muscles. Next. Digastric muscle of the following are, in the given list, the digastric muscles are omohyoid, occipitofrontalis and muscle fibers of ligamentum treats or digastric muscle, whereas sternocleidomastoid has two heads and one belly. It has two heads and it has one belly. That is not a digastric muscle. Next. The most common muscle in the congenital is to be congenitally absent is pectoralis major is the most common muscle to be absent congenitally. Agenesis of this pectoralis major is called as Poland's syndrome. Which of the following is an intra-articular tendon? Anconeus, semitendinosus and semimembranosus are not intra-articular tendons, whereas popliteus is an intra-articular tendon. Actually, popliteus is an intracapsular origin, and this takes its origin from the lateral femoral epicondyle and it gets inserted into the posterior surface of the tibia. It has intracapsular origin. Which of the following is a multipinnate muscle? Deltoid has multipinnate muscle. That is, it has a fiber bundles which converge at several tendons. There will be one tendon, second tendon, third tendon. There will be muscle fibers which converge at several tendons. So that is deltoid muscle. Longest muscle in the body is sartorius is the longest muscle in the body. Multi-unit smooth muscles present are all except multi-unit smooth muscles are blood vessels, iris and ductus deferens. Whereas in the gut we have single unit smooth muscles are present in the gut. So in the gut we have single unit smooth muscle where whole of the muscle contracts and whole of the muscle relaxes at the same time. So these single unit smooth muscles are present in uterus, gastrointestinal tract and bladder. Single unit smooth muscles are seen in ureter, where the whole of the muscle will contract and relaxes at once. Muscles with parallel fibers are all except muscles with parallel fibers are sartorius, rectus abdominis and sternohyoid are muscles with parallel fibers, whereas tibialis anterior is actually a multi-pennate muscle. Tibialis anterior is multi-pennate muscle. Thank you and thank you for watching.